Meet Todd, a 67-year-old man who had a kidney transplant a week ago. Thankfully, the surgery went smoothly and he is recovering well. During this time, he has received unfractionated heparin, an anticoagulant or blood thinner. Pretty standard stuff. Today, however, Todd doesn't look so good. He's sweating, breathing heavily, coughing up blood, and describes sharp localized chest pain that seems to worsen with each breath and cough. Telltale signs of a pulmonary embolism or a blood clot in his lungs. Worse yet, there are black lesions on his left thigh. Skin necrosis, not a good sign. Blood testing reveals that his platelets are low, also known as thrombocytopenia, and they've dropped markedly in the past 2 days. So what happened? Let's start by exploring how the body normally patches up its wounds, a process called hemostasis. Normally, cell fragments called platelets circulate through your blood, chilling. When your blood vessels get injured, however, certain SOS signals get exposed, recruiting and activating platelets to the site of injury to form a loose plug that minimizes blood loss and sets the stage for healing. Your body also has an arsenal of specialized proteins called coagulation factors that can sequentially activate one another, kind of like a game of telephone, to reinforce the platelet plug with a web-like fibrin mesh. This is called the coagulation cascade. Enter heparin. Heparin is a sugar polymer that interferes with the coagulation cascade. If we think of the cascade as a game of telephone, heparin is kind of like a pair of noise-canceling headphones, preventing clot formation and growth. While blood clots are usually helpful, when there's a risk they could block flow to a vital organ, like during a stroke, heparin can be your best friend. But hold on. If heparin prevents blood clotting, how did Todd develop a pulmonary embolism, and why is platelets so low? The culprit is a condition called heparin-induced thrombocytopenia, or HIT. Heparin's strong negative charge allows it to bind platelet factor 4, a protein released by platelets. Normally, it's no big deal, but occasionally, the immune system mistakes the complexes for, which does two things. Number one, it will generate antibodies to mark these complexes for destruction. But number two, paradoxically, it will also trigger clot formation, and both of these will lower platelet levels. So, ironically, the blood clot in Todd's lung was caused by his anti-clotting medication. Similarly, the skin necrosis likely resulted from clots cutting off blood flow to his leg. This fictional case is a friendly reminder that any treatment involves balancing risks and benefits. We should always hope for the best, but be prepared for the worst. Thanks for watching. Follow for more.